Hello, everyone. I'm Sylvia Medina, a senior grants and contract compliance specialist with TCDD. With me today is Dr. Kathryn Jordan Kemere, an assistant professor at the Baylor College of Medicine. Dr. Kemere is director of the TCDD-funded Interprofessional Education for Healthcare Excellence in Adults with IDD. Today, you'll learn more about the project and hear how Dr. Kemere's team is helping to improve health equity for Texans with IDD. Dr. Kemere, thank you for joining us today and to talk about your project. And I will start with the first question. Can you briefly summarize your project's goals and activities?
Yeah, absolutely. The big overarching goal of our project is to train healthcare learners about really basic principles and considerations in providing high quality care for people that have intellectual and developmental disabilities. And so we're really fortunate to be in Houston in a big urban area and have access to a lot of different types of learners. And so what we noticed before starting this project is we would often interact with students, medical students, PA students, nursing students, people from a lot of different professions who felt really unprepared and felt uncomfortable sometimes providing healthcare to people with intellectual and developmental disabilities. And so what we noticed is that these people wanted to learn more, they wanted to do a great job, but they felt like they needed additional skills and knowledge to do that. And so what we've been able to do is we've been able to engage medical students, PA students, nursing students, medical assistant students, residents who are people that are already doctors and continuing their training, fellows, other people who are still continuing their training, and social work students, as well as actually a few members of the community. And what we're doing is we're actually presenting really a multifaceted approach. So some of these learners are coming into our clinical space where I work at a primary care clinic for adults with IDD, and they are actively seeing patients and often together. So a nursing student may go in first and then have a medical student with them who then will see the patient and then come out and talk to one of the attending experts. And so all these different learners are all working on really their roles, but are engaging together and then with experts to really learn best practices. Another piece that some of our learners are doing is they're actually going into the community to be with people with IDD in the places that they live and work and play and go to school. And so one barrier is sometimes the unknown. And we see people in one setting, in a healthcare setting, but we don't often know about what their life looks like outside of that. And so one of the biggest ways that we're increasing comfort and confidence in our learners is having them go to some of our amazing partners and just be with people there. And so if they're going to Summer House, which is a program, they may actually go to the food bank with some of the clients at Summer House, and they're standing right next to somebody that has a developmental disability or sitting next to them, and they're doing whatever volunteering they're doing, and they're doing it together and just catching up on their day. We have other partners where we're seeing where younger individuals might be in school, like the Rise School or the Monarch School. We have people going to the hub and seeing what it looks like to do day programming as you're transitioning to an adult, and several other partners. So it's really fun to actually have people out in the community, and even though they're not providing healthcare in that setting, they're just increasing their comfort. And then finally, one thing that I'll talk a little bit more about in a second is we've really been able to step into some of these health profession schools and embed more curriculum throughout their training in the way to really care for people appropriately that have IDD.
Well, that's great. That's a lot that you're accomplishing through this project. So thank you for that. And so has your project been successful, and how do you know?
Yeah, so I think one thing that's I think really important when you're doing any kind of project is collecting data, because you want to understand, are we moving the needle, and also using that data not just to demonstrate the worth, but then just to keep making future improvements as you go. So we have been able to connect with almost all of the people that have rotated in our clinic, where we're actually serving them and trying to understand a little bit about where they are before they have any of these experiences. So before they come in and do a clinical rotation or before they go to a community site, And then we're getting more data after they've had these experiences about what's changed, how knowledgeable or confident or competent did they feel beforehand, and what's changed and why. We're also getting some really good narrative feedback from people, not just these kind of numbers, but also thinking, what stood out to you? What was different? What was meaningful maybe about this community experience? What did you take from it? And so I think data is one really big piece of it, and being able to look at that frequently and understand it and make adjustments. And I think we know we're being successful because we've had, over 100 different learners every year that most of whom are engaging in multiple day experiences, improving this care. And then I think on a really individual level, we've had some learners who came and did our rotation with us knowing nothing and then left saying, this is actually something I want to do with the rest of my life, which is wild. And so recently we had a medical student who wants to be a psychiatrist, came and did the rotation just like, oh, this is my thing, I'm going to do it. And then left thinking, I want to actually apply to a place, a residency program, and think about a career that's going to take care of these patients. We had another individual that was thinking, I don't know, maybe I'll be an eye doctor, and then came and said, no, I actually want to do primary care and have caring for these patients be a big part of my practice. So we know that we're moving the needle in terms of data, but just in terms of individual stories, it's just great to see an MA student who then got a job in our clinic because they got to spend time with us, or to see a nursing student who's really thinking about, how am I going to do this in the real world? So I think there's a lot of great individual stories as well.
Well, that's great to hear. What has been most surprising to you as you've implemented this project?
So I think one thing is a little bit about what I just talked about, is that sometimes people will come in and won't have a lot of interest, or they won't really know anything. And then all of a sudden, in just a month's time, they're fired up and excited about providing equitable care. And so I think there's some people who will train with us who maybe have a sibling or an association with someone with a developmental disability, and they come in knowing this is important, and they gain extra knowledge and skills. But I think it's been beautiful to see people who maybe come in knowing so little, then to be excited about it afterwards. I think another thing is that probably when I get feedback from learners, the community experiences are actually, I think, some of the most powerful. So while we can teach people nuances of taking care of an individual with this condition or that condition, we're obviously teaching people about different communication styles and using adaptive devices and what that looks like. We're teaching people about how do you examine someone in a wheelchair, and all these things that are really clinic specific and are good. The learners seem to have great benefit from the community experiences, which have nothing to do with healthcare. But I had a learner the other day, a medical student, and she was sitting there getting ready to go in and see the patient. And then the patient walked in and went to the exam room, and she looked up and said, I was just with her yesterday playing basketball, because she had gone to the community site that this individual happens to be with. And the learner's shoulders just kind of relaxed, and the individual saw her, and they knew each other, and they recognized each other. And I think that piece is so much more important than even I realized, that some of this just providing equitable care has to do with this comfort and this being able to see people in the way they are every single day, and see what their strengths are and see what they love to do. And so I think the community experience part I thought was important, but I think it's more important than I even realized.
Well, thank you for that. The next question is, what are some of the lessons that you've learned through this project, and would you do the same thing or something different in the future?
Yeah, so I think one, and I think this maybe speaks a little bit to a challenge that we faced, is it can be really hard, and I think all grant recipients from TCD probably get this, but it can be really hard to have multiple different organizations or groups of people coming together and trying to coordinate that and trying to make your priority fit into all of their priorities. So one thing that I think has been a little bit harder than I realized is when I'm working with different health professional schools or people from different institutions. So if I have nursing students coming, or if we have maybe some social work students that are there, they have their own set of priorities, their own set of things that their school
Mhm.
needs to teach them that they need to be able to do, and they have their own like timeline. And so I think I've had to be a lot more nimble in trying to figure out how to get them this exposure that I think is really important, but kind of on their schedule or on their timeline. I think I originally envisioned that some of the care would even be more interprofessional. And I think that's been really challenging because I often will get certain learners on the days that they can come, and that might not be the same days that other learners can come. And so there's been some sort of external factors that I think have made that hard to coordinate at times. I think if I could do it again, one thing that I would do is be even, and I think this is something actually when I was thinking about this conversation, I was like, still got time, is that I can be even more intentional about some of the interprofessional stuff. And so I can be even more intentional about bringing together healthcare learners from different schools and different professions and having them work together and talk together even more. And so one of the ideas I was having was we really need to have, on days when we have people from multiple places, we need to bring all those learners together at the beginning of the day, almost like a huddle, and sort of talk about, okay, how are we all going to work together today? We do that as professionals, but I also want them to learn to do that as students because interprofessional care is just really important in this population. So I think that's probably my biggest challenge or surprise is how do I take people with different priorities and different schedules and kind of make it all work together?
Okay, well, thank you. Another question is, how do you expect this project to improve equity in healthcare for Texans with IDD?
Great. So I think one piece is that the more people we're exposing, all these people are going to go out and provide care. So many of them are Texans. Actually, the majority of our medical students are Texans. So a lot of them are going to stay in the state. And it may be, they may not go to a clinic that exclusively provides care for this population. They may not be in any kind of a setting where they're only seeing people with IDD. But what they've learned here, they're going to take with them wherever they go. And then they're also going to be able to help their colleagues and teach their colleagues. We talk about that a lot. When you join a practice one day, you may be the expert in this particular field. And so you actually have to teach other people, other doctors, other nurses, other medical students, other MAs at your place of work about this stuff. And so I think just because we're reaching a lot of people, I think the more doctors that we can produce that are that know some basic principles, the better. So I think that's one thing in the future. If you're somebody with DD, you're going to be more likely to meet someone that's had some training and exposure in equitable care. Another way that I think the project is helping Texans in general, and I hope will help them continue in the future, is that one piece of the project is in this past year, I've really tried to connect with people at other medical schools and other institutions across the state. So we've done this really great job of embedding in our curriculum different steps along the way where every single medical student, all 210 per year at Baylor College of Medicine, are getting some training in this. And so I really think that this is where things are moving. And so I've been meeting with people from different medical schools across the state. How can you start to implement something similar at your institution? So it's not just people that are in med school in Houston, it's people in Lubbock or people in Dallas or people in San Antonio. And so if we can help people replicate what we're doing here or do their own thing, but that works for them, I think that even really magnifies our impact.
Oh, great, great. Will your organization continue any of this project after your TCDD funding ends?
Yeah, no, I think that's the other exciting piece. So, as I've mentioned a few times, we actually started off with not that much time in the general med school curriculum at all for this. And then over the past few years, we have basically embedded ourselves almost in every single year of medical school. And this is stuff that's been improved by our curriculum committee that's like part of what every Baylor College of Medicine student will learn. And so getting in there as we were sort of reworking and rewriting our curriculum was really awesome and really pivotal. And I think that will continue. I mean, that definitely will continue beyond the end of the project. The other thing that's been great is we've really sort of become known at Baylor for a clinic and a group that wants to educate everybody. And so we've had increasing requests every year to host more and more learners from different residency programs that are part of different like courses in med school. We even have people that come from other states that will come and rotate in our clinic now to be able to learn about what we're doing, and residents from other places too. And we've really built the infrastructure in our section, in our group, to continue to do that, and really built the process. And I think that grant allowed us to explore and figure out what works, what doesn't work when we bring in learners, how do we process that, who do we need to be able to schedule them and do all the things. And so we're kind of now known as the section that will train people. And so I don't see any barriers actually for this to continue even when the funding is done, which was really our goal.
Oh, that's great to hear. So the final questions are, how could this work be expanded to other healthcare settings? And what would you do? What would you like to see?
Yeah. So I think some of it I touched on a little bit earlier. And so I think I'm probably more of an expert in teaching learners, though I do sometimes teach peers, so teach other doctors that are out in practice about this. So one is that, within the state of Texas, I've reached out and been in conversations with multiple different places. UT Southwestern actually has already started like a very miniature version of our curriculum, which is really cool. And then we actually have a group of people nationally at about 50 or so different medical schools across the country that we started, where we're talking all the time about how do we provide high quality care, and then encouraging each other about how do we actually educate people in this space. And so I think that's one way to have this expand, is to sort of set that standard. The other thing is that I've been working with the governing bodies for like resident medical student education to think about how do we on a national level require some of these concepts to be part of training. And so that's really an ongoing conversation, but we had a summit about a year ago, was the first time that they'd ever had a meeting like this. And that was with the ACGME, which is the resident governing body. And the summit was all on the care of people with disabilities and how do we embed this into requirements for residency training. So I think that there's local and bigger things moving forward that I think is really gonna cause many more people to receive equitable care. And so I think that's really great. And I guess what I'd like to see is I'd like to see that every healthcare learner, regardless of what professional school you go into, has exposure and training to be able to communicate and examine all people. So people with all different kinds of communication styles, all different mobility needs and physical strengths and weaknesses, and that they would be able to enter their profession and know that they are trained to take care of everyone. And so that's really the big goal. And so we're just trying to move as many people we can towards that goal.
Well, thank you again, Dr. Kemere, for sharing your work with us. And also, I want to thank the council members for taking time today to learn more about this project and its impact.
Thank you. I really am so thankful for the grant support and with my interaction with TCDD.